Esteemed colleagues, we're happy to welcome you here in Moscow, and allow me esteemed gentlemen of the Secretariat, can you please provide the headphones for our guests? They need to listen to the translation. Thank you. So now we are opening the 6th conference of EECAAC, and this year is a record year. 2,900 delegates from all over the world, from over 100 countries, from the NGOs, government organizations, health organizations, which shows that this is a very acute goal, and all the countries are committed to facing this problem. Allow me to first introduce our guest, our honorable guest, who is the chair. The chair of this meeting now is Olga Yuryevna Golodets, the Deputy Prime Minister of the Russian Federation. We are welcomed by the by Mr. Morozov, who is also Duma Deputy, the Undersecretary General, Mr. Ren Minhoy, the Deputy Minister, the Deputy Minister of the Healthcare Ministry in Russia, Mr. Krayevoy, the Deputy Minister of the Ministry of External Affairs, the Counselor of the Russian Federation government, Mr. Fedotov, Bishop Mifodzi from Arpis, and the coordinator of the Kazakhstan HIV people, Rostokina Yelena. And allow me also to introduce the co-chairs and the organizers of this conference. First of all, Michel Sidibe, who is the Undersecretary General, United Nations, and Executive Director of Joint United Nations Program on HIV/AIDS, UNAIDS. Also, will be joined by Mr. Anishenko, who is the first Deputy Chairman, and I'm Anna Popova. I'm the head of the Federal Service for Surveillance of Consumer Rights. Dear colleagues, I want to say that in organizing the 6th conference, we focused in the Russian Federation. The most important role was played by the government of the Russian Federation. The chairman of the Russian Federation government, Mr. Medvedev, took an active part in it, and also Olga Golodets took an active part in the preparation for this conference. So the floor is given to Olga Golodets. Esteemed Mr. Sidibe, dear friends, allow me to first of all, to read the greeting from the head of the government. Dear friends, I want to welcome you in Moscow at the 6th EECAAC conference. This is a unique discussion venue with almost 3,000 delegates from dozens of world countries to discuss HIV/AIDS, which is a global problem which all the countries face. Tens of millions of people all over the world live with this disease, and due to the efforts of the scientists, medics, we have hope in resisting this disease. And in the Russian Federation, our government is fighting HIV actively, and a lot of finances are channeled into this activity. A lot has been done, but we need to adopt state-of-the-art technologies. We need better epidemiological surveillance. We need to enhance the care for the patients. We need also to enhance the social support for these people, and of course we need investments into the scientific research. I'm quite sure that the conference will be the venue for discussions, exchange of experience and expertise. I wish you good luck, because the results of this conference will be very beneficial for the people who have HIV/AIDS. Dmitry Medvedev, the chairman of the Russian Federation government. Dear friends, I would like to say a few words here also, because the problem that you're going to discuss today is a very important problem. I just want to outline how important it is for the world, because in UN estimations, from the start of the epidemics, over 78 million people have been infected, and almost half of them died. And as a matter of fact, the problem is on the rise in the whole world. It has been spreading even in the so-called being countries and the strata of their population, because it used to be related to a social lifestyle, but right now we see HIV/AIDS patients in really good standing families, and we have adopted a special program in Russia, and we seriously increased the number of patients that are receiving treatment. We now have about 1 million Russians with this diagnosis, and more than 280,000 people died from this disease in our country. The RT treatment is provided for 46,000 people, and we are monitoring the development of the medical care all the time. It's not only important to buy the ART drugs. We are always talking about the availability and affordability of this drug, but we also need to breed the compliance, which is not an easy task. We have some breakthroughs as of today. Women who are infected with HIV, it is quite possible to give birth. It's quite possible for them to give birth to healthy children, and it's a breakthrough in our healthcare system. HIV/AIDS is a very serious disease infection that requires the efforts of all the strata of society, including even the volunteers whom you can see in front of us. We all need to take part in this effort. And in this respect, this conference is a very serious educational attempt. I'm very grateful to Mr. Sidibe for his active position in opposing the spread of HIV, because only together we can overcome this really serious disease. I wish you good luck. Thank you very much, Olga Yurievna, and I would like Mr. Sidibe, the Undersecretary, United Nations Executive Director, Joint United Nations Program on HIV, Mr. Sidibe.
Honorable Deputy Prime Minister, honorable ministers, dear co-chairs, colleagues and friends. It is an honor and privilege for me to be here in Moscow to open this very important conference. With nearly 3,000 participants, I can say that this conference today is certainly the biggest one we organize in Eastern Europe and Central Asia. This gathering is not just about state participants. It's about civil society, scientists, private sector, all are together here to take stock of progress in this region and also to think about the needed transformation to make sure that we control epidemic in Eastern Europe and Central Asia. I was here, in fact, in Moscow for the ministerial conference on TB. President Putin's opening address showed that political leadership is essential to lead the way to ending an epidemic. It was clear that TB cannot longer just be a technical issue. The same is true for ending AIDS. This conference is very important and a unique opportunity, like I said, to take stock and highlight gaps. Since the last conference, most countries in this region adopted test and treat policy. The cost of treatment has fallen from $2,000 per person per year to less than $200 per person per year. I said from 2,000 to 200. We've been able to really work to make sure with our government partners that we can have a consolidated procurement approach. And I want to say also that Armenia and Belarus have eliminated mother-to-child transmission of HIV. Let us clap for this achievement. No one could have believed that we could have been here and say that we will have a new generation born without HIV a few years ago. It's becoming a reality in many places today in the world. According to official data for Russia, in 2016, the increase in number of new HIV diagnoses was 10%. And in 2017, the increase was 2.2%. This is a real positive trend. The campaign Stop HIV/AIDS, led by Madame Medvedeva, raised public awareness about HIV and testing. Last year, I met President Lukashenko in Minsk, and I was very impressed by his personal commitment to end AIDS. Russia is strengthening its partnership with UNAIDS. Our joint cooperation program, implemented with InfoShare, will help to reach 1990 in Armenia, Belarus, Kyrgyzstan, and Tajikistan. But, as you can imagine, anytime I've been in this conference, I was also sound the alarm about the trend of new infection in this region. And I'm very scared and concerned because what I'm seeing today is that epidemic is moving from concentrated population to general population. And that is very scary because more than 55% of the new infection are becoming heterosexual in Eastern Europe. So the epidemic moving into general population is posing a real threat to economic growth and demographic stability. We have to pay attention because after South Africa and Nigeria, Russian Federation has the third largest number of new infections. And that is a question for the stability of the nation, because the demographic pattern could be largely affected. That is why we must urgently rethink prevention in this region. I encourage all countries in the region to join a global HIV prevention coalition. All countries need to implement evidence-based HIV prevention programs, including comprehensive sexuality education, PrEP, condom demand creation, and harm reduction. No one is too hard to reach, but we are not investing where we need to. In this region, just to give you a sense of what is happening, just 3% of the total HIV expenditure are going to reach key population. Population which I was just describing left behind, population who are, unfortunately, the source of the infection to general population because they are not rich and they are not having access to life-saving services. Community-based and led programs work. We must demedicalize the response. There is an outreach program for a sex worker in St. Petersburg. I visited this program years back. It's clearly showing that community-based intervention can fast-track the response and prevent new infection. Programs like this need to be maintained. Unfortunately, we are still having a major problem with stigma and discrimination. We have broken down the wall of silence around HIV. We have not broken down the wall of exclusion, the wall of prejudice, the wall of stigma, the wall of discrimination. It is about upholding everyone's right to health. Key population, like migrant, sex worker, people who inject drugs, transgender, prisoner, and men who have sex with men need to have their right to health respected. Discrimination is blocking our effort to end AIDS. 1 in 8 persons living with HIV report having faced discrimination in a healthcare setting in the world, which is high, 1 in 8. People who inject the drugs are forced into shadows and are not able to seek health care. Everyone has the right to health, no exception. That is why I'm calling for zero discrimination in all health care setting. After nearly 40 years of the AIDS epidemic, like the Deputy Prime Minister said, more than 70 million people infected, more than half of them died. We should take AIDS out of isolation. Take TB. TB is the leading cause of death among people living with HIV globally and here in the region. In 2016, there were over, 230,000 TB cases in this region. We will never end the TB epidemic if we don't also manage TB-HIV co-infection. The same applies to HIV and Hep C. We have over 1.6 million people living with HIV in the region, and over 10 million people in this region are living with Hep C. We have a triple epidemics, HIV, TB, and Hep C. But we need one integrated approach to prevention, diagnosis, and treatment. People are living longer with HIV. HIV is now a chronic condition. Quality of life must be addressed. So mass NCDs and aging with HIV need to be also taken into account when we talk about people living with HIV. I cannot end without talking about the June World Cup. The World Cup in June is a bigger than football. It is about uniting, not dividing. We need to leverage this moment for promoting HIV prevention and zero discrimination. And the World Cup can be a symbol of freedom of movement for all, regardless of HIV status. We started yesterday with UNAIDS World Cup to end AIDS and discrimination, with the players from the Russian government, international football stars, and people living with HIV. Russia has everything, and I said has everything it needs to end AIDS and help other countries in the region. Scientific achievement, resources, and clear understanding of the nature of the epidemic. UNAIDS stands ready to work with the Russian leadership to develop and launch a fast-track plan for the Russian Federation as an urgent priority. We must also leverage fast-track cities approach and work with the mayors towards 90-90-90. Clearly, we have to do a lot more and a lot faster. AIDS is not over in Eastern Europe and Central Asia, but it can be, and I am sure in 2020, when we will be in Russia, we'll be able to announce that Russian Federation reached 90-90-90. Thank you very much.
Спасибо глубоко, уважаемый господин.
Thank you very much, Mr. Sidibe. And allow me on behalf of the organizing committee, co-chairs, to welcome the conference. Esteemed colleagues, allow me once again extend my gratitude for your participation, for being here in spite of the fact that the world is not quite calm today, for your active work in this venue. Together with you, I'm happy that for the first time in the history of the conference, we have about 3,000 participants, and we're going to work for 3 days. And in order to make it a success, we started preparing this conference immediately after we finished working at the 5th conference in 2016. So there were 3 symposiums, there were several consultations with the business community, and we were not only preparing the conference, we also reflected the commitments which we undertook in the previous conference. We had the program of action and we implemented this program. And due to our commitment to resolving the task, we've managed to do a lot. I wanted to say that in the Russian Federation, we oppose the HIV infection, and Olga Yurievna has already mentioned it, Mr. Sidibe mentioned it, but I wanted to focus on the increase of the HIV testing, which accounted for over 38 million people, every 1/4 person in the Russian Federation. Back in 2012, we only had 1/3. And we had the minimum the minimum possibility of the vertical transfer of this disease from mother to child. We managed to curtail the spread of the infection, and for the first time ever, in 2017 we only had 2% growth, and we had in 2012 we had 13.4%, and this is the result of our joint effort. This is the result of our joint activities. This conference is the key mechanisms of opposing the HIV infection in these two regions, and we're going to discuss the challenges related to HIV in E and C and outline the priority directions of opposing this infection. We're going to share the experience of innovations. There are several sessions, 5 open sites, the exhibition, and so on. In this venue, and for the first time ever, we'll have the business summit where we'll be able to speak to the representatives of the private business. For the 35 years, the HIV epidemic has been the major problem all over the world, because all the countries are facing this problem. All these challenges are not new, but we need to find innovative ways of opposing this disease in our region, and this is the aim of our conference. So the focus of the conference, all the country focuses on the conference. The country knows the problems, the country focuses on the problems, targets the problems, and you've already heard the greeting from the chairman of the Russian Federation government. The person who opened the conference is the deputy chairman of the Russian Federation government. And allow me also to read the greeting of the chairman of the Federal Assembly. To the participants of the 6th International Conference HIV, on behalf of the Federal Assembly of the Russian Federation and me personally, I want to greet the participants of EECAAC 2018, because this is one of the spread of the HIV infection is the key challenge in our time, and it is the spread to the economic development of the country. We actively support the efforts to curb this infection. We're working on the breakthrough methodologies and the drugs to fight this plague of the 21st century, and it involves the healthcare officials, the academia, who are doing their best to curb the infection, and I'm quite hope that the conference will be able to promote the state-of-the-art methods of treatment. I wish you all the best. I wish you all the best during the work of the conference. Every success. Valentina Matvienko.
I'm now glad to give the floor to the chairman of the Committee of the State Duma on Education and Healthcare, Dmitry Morozov. Good morning, dear Olga, dear Anna, dear Mr. Sidibe, dear colleagues. This is a really important day we're having today, and on behalf of our Committee on Healthcare at the State Duma of the Russian Federation, let me welcome all the participants and guests of the 6th International Conference on AIDS in Central Asia and Eastern Europe. And I would like to read out the address, which has the warm words for you. And it's undoubtedly that the problem of diagnosis of HIV requires the combined effort of all the stakeholders, medical specialists, patients, and overall community. HIV is a challenge for the humanity. It's the test for the strength of the humanity, for its possibility to lead responsible life and moral life. And we are convinced that by 2030 we will be able to combat this disease. But if the humanity will not make due conclusions, then other diseases will come. The program of this scientific conference will have 3 days. It's really diverse, and we're really glad that experts of professional community, religious representatives, and all other kinds of specialists are here. On behalf of legislative authority of the State Duma, HIV and AIDS issue is on the top of our agenda. And it has been underlined today that it's of crucial importance. What we managed to obtain, we have increased the funding of programs that are combating HIV and AIDS. So we have increased this funding, including prophylaxis of viral hepatitis B and C. So more than 21 billion rubles were allocated for this issue versus 17 billion rubles in 2013, and this was a result of combined effort of deputies of the Federal Assembly and professional community. The State Duma deputies and healthcare specialists have arranged monitoring of medications for HIV patients. Last year, a very important thing happened. Procurement of ARVs have moved to the federal level. And right now, the deputies are in close contact with the population, and they're absolutely aware about what medications are needed, what constituent regions of Russian Federations are in the foremost need of them. On top of that, legislative improvement of the law in terms of how to support HIV-positive people, special task forces and working groups as part of the healthcare committee have been established, and they're proactively working. The WHO effort and Moscow office of WHO is very supportive, and we need to continue expanding our partnership, expanding our cooperation, and keep on engaging them more and more so that we have a consolidated expert opinion. Regardless of the decisions that we make, the challenges are still here. Our successes give us even higher ranking objectives. We're really concerned about HIV dissidency, which is, we believe, promoting it among young population can lead to the catastrophe. Therefore, the community should not allow this sort of propagation. As for internet resources, web resources, or mass media, this implication of HIV dissident behavior will not lead to good things. Early diagnostics of HIV is also the thing that we are concerned. Lack of medical professionals in our regions is another priority on our list. The discrimination that was touched upon by Mr. Civic is another point that we need to hardly work on. Myself, being a surgeon for kids, I'd like to stand out the prophylaxis of surgeon, taking care of rights of medical professionals, awareness of both sides. All these things require our understanding and timely legislative support. Medical personnel qualification improvement. This is another important issue. Therefore, we need to closely act with universities, with medical academies, and support the specialists in terms of improving their knowledge and expertise. Professional scholarships and internships for young doctors, another part which we also need to work on. Russian Federation is ready to share its experience in terms of its measures that were taken in terms of preventing proliferation of HIV. We have run more than 20,000 activities last year, and I would say that these activities were run by students of medical academies, volunteers, and our future colleagues. Another important component of this activity, which is called Moving Ahead, is commitment to antiretrovirus therapy. Without ART, all our efforts are zero. Therefore, in order to promote healthy lifestyle for the next years, we are preparing more than 50,000 publications devoted to that. So information space, mass media space, and taking care, controlling it is very important. Russian regions are involving socially oriented, non-governmental organization, another important part of our job. At the same time, Russian Federation is one of few countries in the world which supports socially oriented NGOs using federal budget. Right now, when HIV has a big spread amount, therefore we need to act collectively. We need to work out comprehensive recommendations of rules without HIV and with HIV. We need to take care about our children and give zero probability to vertical transmission of HIV, give the chance to create healthy families. And I'm absolutely convinced that our discussions today will be very fruitful, will be productive, will give the platform to exchange the valuable experience that you have so that we can contribute to higher safety and higher security in this aspect. And I would like to once again underline a very proactive position of the State Duma on that. We are here to support you.
Большое спасибо, Дмитрий Анатольевич.
Thank you very much, Dmitry. And I would like now to hand over to the organization, which is very critical in terms of combating. I'd like to hand over to WHO, Mr. Ran Min Hoi.
Honorable Madam Chair, distinguished delegates, ladies and gentlemen, I must thank the conference organizers for inviting World Health Organization to participate in this very important conference, and the government of Russia for once again hosting this regional event. This year we celebrate the 70th anniversary for World Health Organization and the 40th anniversary for the adoption of Alamata Declaration on Primary Health Care. It was in this region that primary health care was elevated as global public health priority. And later this year, the countries will be reaffirming this commitment. At the same time, the government, United Nations agencies, and development actors are also committed to achieving sustainable development goals, including ending the AIDS and tuberculosis by 2030, and combating viral hepatitis. The attainment of a universal health coverage is central to the SDG agenda. Universal health coverage means that all people should receive the health services and health commodities that needs without suffering financial harness. Health is a human right, and the government is obligated to build resilient systems of health protection that gives everyone the equal opportunities to enjoy the highest attainable level of health. But are we on track to end the world's greatest communicable epidemic? Are we on track to end AIDS? It seems that since last regional conference 2 years ago, which I also had the privilege to attend, only limited progress has been made. The challenges in Eastern Europe and Central Asia are still substantial. More than 1/3 of people living with HIV do not know they are infected. Less than 1/3 people with HIV are receiving antiviral therapies, compared with 76% in West and Central Europe. In 2016, the Eastern Europe and Central Asia accounted for 78% of all new HIV infections reported through to Europe. Clearly and unfortunately, the region is not on track to meet HIV target. Robust action is urgent need to reverse the current trends. And I believe there are 6 areas where intensified actions is required. First of all, we need to recognize that HIV's epidemic in the region are concentrated in specific populations, notably among the people who inject drugs and their sexual partners, the men who have sex with men, sexual workers, and their clients, and the prisoners. To achieve the greatest impact, We need to focus on these key populations and locations most affected. Strong health information systems, which disaggregate data, are critical to guide HIV investments, to effective response to changing HIV epidemic and contexts, and to ensure the accountability across all the stakeholders. Second, such a targeted approach should be reflected in national HIV/AIDS strategy that are fully integrated into national health programs supported by strong political commitment, highest level advocacy, and sufficient financials and human resources. The power of global advocacy was demonstrated in November 2017 when the Russia's government hosted the first ever global ministerial conference on ending tuberculosis, with 75 ministers across the world demonstrating their renewed commitment to addressing tuberculosis epidemic through the Moscow Declaration to End TB. The conference highlighted the critical importance of drug-resistant tuberculosis and links between the HIV and the tuberculosis epidemics. If the region to reach the targets of ending tuberculosis by 2030, we will need to witness the same level of political commitment around HIV/AIDS as we have seen with tuberculosis. Third, the countries will achieve the greatest impact if they invest in interventions and services that are evidence-based and quality assured. The investment should cover the full continuums of HIV services, from the health promotions, preventions, testing, and diagnosis, through to the treatments and chronic care. A review of regional data demonstrates the major gaps in HIV/AIDS testing and treatment. This highlights the urgent need to take a more strategic approach to HIV testing to reach the most vulnerable populations at risk and affected, and to diagnose people with HIV/AIDS as early as possible. WHO recommendations to treat all people with HIV/AIDS means that treatment should be made available to all populations, no matter who they are or whether they live, whether they are drug users, men who sex with men, migrants, or infants. And the programs in the region should be promoting integrated care for both HIV and tuberculosis. The fact that HIV/AIDS epidemics continue to remain high in this region also demonstrates the major weakness in prevention programs. What WHO is most concerned about is the gaps in prevention of a higher impact evidence-based prevention intervention for key populations where HIV epidemics are concentrated. For example, lower coverage of needle syringe programs and opium substance therapies compromise HIV/AIDS prevention efforts among the people who inject drugs. We are also concerned about the laws that marginalize key populations and promote stigma and discriminations, stop people from reaching the HIV/AIDS prevention services they need. The reach and the sensibility of this essential intervention will depend on the extent to which they are included in the National Health Benefit Package and funded through the National Health Budget. Fourthly, the success of HIV/AIDS programs will depend on whether the higher impact interventions can reach those populations and locations that need these services most. Integrated, decentralized, and differential services delivery models provide opportunities to reach the most vulnerable and the marginalized populations and to reach the health equity. In this region, where the most HIV/AIDS epidemic are concentrated among the key populations, the full engagement of civil society in response and strengthening The community's health systems will be essential if we are to reach the HIV and universal health coverage. The provision of people-centered healthcare service is central to the achievement of universal health coverage. People living with HIV in the region experience multiple health challenges, including co-infections such as tuberculosis and viral hepatitis, and other comorbidities such as alcohol and other drug dependencies. By adopting the people-centered approach, HIV services can address the broad health needs of people living with HIVs. Fifth, the systems for financing health HIV response in the region will need to support those who are least able to pay to provide service free of charge at the point of care. Key and marginalized population will need to be brought in from the dark and covered by such safety net as public health insurance. Finally, to end the AIDS epidemic by 2030, we'll need new and improved medicines, diagnosis, and service delivery models. This region can make the valuable contributions to research and development, to build solutions, to find a solution to the old and emerging challenges. Ladies and gentlemen, this region holds the huge potential to transform the AIDS response, to reverse the growing HIV epidemic in many countries, to address the many health inequities that occur across the region, to protect those most vulnerable, and to make the universal health coverage a reality. This conference is ideally positioned to reflect on regional situation and to propose new ways forward. I wish you well in your deliberations and look forward to hearing about the conference outcomes. We should inform the discussion to take place during the International AIDS Conference 2018 in Amsterdam. In association with the conference, the WHO Regional Director for Europe is planning to host a minister policy dialogue on 23rd July for the health ministers from Eastern Europe and Central Asia regions to discuss the opportunity to intensify the regional response to the HIV/AIDS. Rest assured, the World Health Organization is here to support you, together with the UNAIDS and other partners, on the path towards ending AIDS and achieving universal health coverage. Thank you very much for your attention. Спасибо.
Большое спасибо.
Thank you very much, Dr. Min Hui, for that exhaustive report, that program report, and the welcoming speech. And I'm happy to give floor to the Deputy Minister of Healthcare of the Russian Federation, Mr. Kraevoy. The floor is yours, Sergei Alexandrovich. Good morning, dear colleagues, dear friends. On behalf of the Healthcare Ministry of the Russian Federation, on behalf of the multi-thousand community of doctors and healthcare specialists, allow me to greet you the 6th International Conference for HIV/AIDS. In spite of the diagnostics successes, in spite of all the progress in drug development, this is still a continuing threat to the population of the world. It's not only a medical but a social problem. Everyone can be affected by this disease, even in high standard countries with quality medicine. So that, of course, causes a very serious concern in the international communities. And opposing the HIV infection is one of the priorities of the Russian Federation. In 2016, the program was adopted following the United Nations programs of opposing HIV/AIDS. We take a multilateral approach. More than 20 federal agencies are participating in this program, and all the territories of the Russian Federation, the NGOs, the trade unions, business community, and every region in the country, in accordance with the federal strategy, implements the urgent measures to oppose the spread of HIV infection, and they are monitors, they are adjusted by the federal program of monitoring by key indicators, practically in the online mode. And for the first time ever, the prophylactics of the infection, which is headed by Mrs. Svetlana Medvedeva, and the executive powers, the health community, NGOs, and business partners, we adopted a multi-directional approach, which involves all kinds of companies, communication companies, all sorts of activities, the forums of specialists, which are annual, and also the information portal, the information website for HIV/AIDS. We carry out prophylactic efforts, including also the efforts of NGOs. We optimize the screening structure in every territory of the Russian Federation, focusing on the key sections of the population based on the epidemiological situation in every particular region. For over 20 years, the healthcare organizations in all the territories are equipped with the state-of-the-art test systems. The drugs provided to HIV infected people are provided free of charge by the federal government, and this is a very important instrument, not only in monitoring the epidemiological situation, but also providing the high quality assistance, consistency, managing the situation. All the set of measures, including providing the drugs for HIV, is free of charge for the citizens of our country. Also, we provide social support measures, and we achieved some positive results. In 2017, for the first time ever, we had a widely spread testing program over 40 million people. It is 30% higher than previously in the previous years, and the detection has been raised by 85%. The patients, the new patients detection is about 86,000. It's at the level of 2016, and about 20% of all these people are treated in clinics, which shows the early adherence to the program. We centralized the purchase of antiretrovirus preparations, and we saved the budget money and managed to increase the supply of drugs by 50% in 2017 without attracting any more budget funds. The increase of patients with ART is, the new patients with ART is over 60,000 more, and all of them are getting the therapy. We also have prophylaxis for TB. Over 90% of all the monitored patients were tested for TB, and we also provide chemoprophylaxis of TB in HIV-detected patients, and the numbers are less than 2% now. Also, we provide more availability for drugs in all the territories, and also we treat the TB comorbidity. Also, we try to suppress the stigma and prejudices in the society. But in order to have the drastic change in this area, we need new approaches, both at the national and international level. The joint work of all the government, social NGOs and other organizations, and only in this way we can control the spread of the HIV infection. And I wish you all good work during this forum. Thank you. Thank you very much, Sergei Alexandrovich. And a very important component of cooperation with international organizations, of course, with other regions, countries. The key role here is for the Minister of Foreign Affairs, and Mr. Punking, the Deputy Minister of the Minister of Foreign Affairs, is given floor. Esteemed co-chairs of the conference, esteemed delegates, ladies and gentlemen, on behalf of the Ministry of Foreign Affairs, I'm happy to welcome all the participants of the 6th conference of EECAAC. I'm very happy that this really highly esteemed forum in Moscow with about 3,000 participants, the healthcare specialists, politicians, NGOs, international organizations, representatives. It's in very high demand now, especially considering the situation and the challenges in our regions. The latest achievements in the opposing HIV, the spread of ART, reduction of morbidity related to HIV. All these give us hope that by 2030, as it is indicated in the program adopted by the world leaders, these goals will be achieved. And Russia is totally committed to this agenda. In spite of the progress that we can witness, the achievements are still very shaky, and a lot needs to be done. We understand it. Opposing HIV/AIDS is only possible if we consolidate the efforts of all the world community and identify the future path to resolve this problem, which of course requires a comprehensive approach, taking into consideration the cultural and religion and legal specifics of each country. And you can find it in the Declaration of the United Nations on HIV/AIDS of 2016. The Russian Federation is working on prevention of the HIV infection spread at the national level. We are very efficient in our cooperation with our civil society, with our international partners. This work is widely spread. It has a wide financial, political, and expert support, and it is carried out openly in the atmosphere of discussion with various strata of society, all the problems and challenges related to HIV. Russia is one of the donors of international development, and the input of Russia in enhancement the potential of the countries, poor countries, especially in the territories of our serious partners. And in this activity, we want to combine the government efforts and government mechanisms providing human and technological resources. We proceed from the idea that this is, first of all, an investment into global stability and an effective mechanism of enhancing the relations between the countries and forming a crisis-resistant world system. We think that we need to use all the potential of the United Nations agencies, because their non-political efforts are of great value. And one of our consistent international partners with joint programs is the UNAIDS, and we hope that we'll be able to enhance our pragmatic dialogue with UNAIDS, and we can also combine our efforts, and we're going to support to the best of our abilities, UNAID with intellectual and other efforts. I'm quite sure that this three-day forum will receive a very positive from the society, and will be closer to our goal of HIV/AIDS-free world, and that relates to a number of saved lives and happy living. Thank you very much. Thank you, Alexander. Thank you very much for your welcome speech. And right now, I want to invite the Deputy Minister of the Healthcare Ministry of Armenia, Mr. Margaryan. Samvel, you're welcome. Esteemed colleagues, I'm going to be very brief. I just want to welcome all the participants of the conference. I want to note that Armenia is one of the participants of the world community opposing HIV, and a very important regional participant in this area. We have a very successful cooperation with all the organizations, both in the world, and we work with UNAIDS Global Foundation. We have very tight relations with the Russian Federation and a great cooperation program. I want to welcome all the participants in this conference, and again I want to focus on the very important role of this conference, both locally and globally. Thank you very much. Thank you very much, Samvela Sharusovic. And the floor is given to the Vice Minister, Healthcare Ministry of Kazakhstan, Mr. Tsoy. Esteemed ladies and gentlemen, allow me on behalf of the Healthcare Ministry of Kazakhstan and the delegation of our country to greet you here at the international conference. Opposing HIV/AIDS is one of the priorities in the Republic, taking into consideration the seriousness of this effort, because it affects not only the healthcare, but all the aspects of the life of our people. We in Kazakhstan take a multi-sectoral approach to curbing the spread of this infection. It's of principal importance to participate in this conference because it's a good venue for exchange of strategies and sharing. We want to curb the epidemic by 2030. It's one of the Sustainable Development Goals for the mankind, which was unanimously adopted by all the United Nations countries. We have also seen the adoption of the declaration, which was also adopted by all the countries at the United Nations to stop the HIV in 2030. And UNAIDS developed the strategy for curbing the epidemics by 2030, including the 1990 goals. It is possible to reach this goal only by our combined efforts, all the health ministries, all the HIV-affected people, academia, politicians, experts, and other interest stakeholders. In Kazakhstan, we have an open access to testing. We test over 2 million people for HIV, and we think that over 80 people of the HIV status, people know about it. We have the spread of 1% only. The increase of 1% is much lower than the world figures. We provide the ART free of charge for the patients, and RT is provided to about 80% of all the patients which need it. We reorganized the acquisition of drugs. We use the international mechanisms, and that allows us to reduce the cost more than 3 times, and we have access to new preparations for RT, and we lowered the morbidity of HIV/AIDS people. It's only 10.2% in 2016, so the life is longer and happier for those affected by HIV/AIDS. We have implemented more than half of the recommendations. 16 recommendations, 4 are in the process of implementation. We stopped the vertical transfer from mother to child because of the prophylactics in compliance with the latest recommendations of WHO, and we are striving for that certificate for the elimination of the vertical transfer. We cannot stop the migration, of course, and the common area of E and CA is a fact of life, but we cannot now provide the adequate healthcare for the migrants. That's why we want to launch the initiative to develop the uniform legal and healthcare space for the EE and CA. Kazakhstan is going to start providing all the scope of treatment for the migrants, including ART, and it's an honor to us to invite you to the global conference devoted to the 40 years of the Almaty Declaration for providing healthcare assistance, which will take place in Astana, and where we'll discuss the issues of prophylaxis and the treatment of AIDS. And in conclusion, I call upon all of you to take an active part in the work of this conference. I think that we can combine our efforts in EE and CA and oppose the spread of the infection.
Большое спасибо, Алексей Владимирович.
Thank you so much, Alexei Vladimirovich. And representatives of religious confessions are also very active in this conference, are an important part of this conference, and I would like to hand over to Kamensky Bishop Methodius. Dear organizers, dear participants, dear guests of the conference, it is 6th time that we meet at the platform of this highly authoritative international forum in order to discuss the situation and our countermeasures. HIV and AIDS problem is outside of the scope of responsibility of healthcare agencies, and therefore combating proliferation of this disease has brought together economic, healthcare, and religious institutions all over the world. HIV does not differentiate between religions, between nations, or between different groups of population, and it's a serious challenge. Russian Orthodox Church for many years has been contributing to this prevention by social and psychological support to HIV-positive people, to their families. We are also engaged in educational and other activities which are aimed at raising awareness. HIV people are not outcasts for Russian Orthodox Church. HIV is a challenge. It's not a stigma. Therefore, one of the most important goals is prevention of HIV and prophylaxis of HIV among IDUs, injection drug users. And by the end of 2017, more than 116 Orthodox organizations were working in the Russian Federation who provided support to injection drug users. A number of rehabilitation centers, a number of motivation centers, psychological support centers. Rehabilitation of drug users programs are also run in several monasteries of the Russian Orthodox Church. And among those people who seek support, a lot of them have positive status. Our collective action, which is aimed at strengthening moral values and mindset, are very important. A lot of attention should be paid to responsible treatment of your beloved person, of your family, of your children, especially such values as compassion, empathy. And one of the lessons that should be learned by the community after the epidemic of HIV and AIDS is understanding the value of the mental side and moral side of a person, how important it is. And we need to acknowledge a simple truth. Being moral, these are not simple words that are put on the wall. This is an undermining a foundational principle which is in the heart of the behavior of people that also determine the way the person will live his life and, in the end of the day, how the nation is going to live. Therefore, I would like to wish all of you the support of the Lord, and I hope that our discussions will be bringing us very good results. Thank you so much for your words. So this is truth. If someone is sneezing, it means that the words are correct. I would like to give the floor to the counselor, to the president of Russian Federation and head of the Committee on Human Rights Development, Mikhail Fedotov. Dear ladies and gentlemen, this is not my first time when I'm invited and participate in this conference. This is the 6th conference, as we know, and every time on behalf of the Presidential Committee on Human Rights, I'm voicing our opinion about the role of the civil society in the aspect of preventing the proliferation of HIV. The Presidential Committee on Human Rights is focused on this problem, and every time when we are running our regional activities, we always visit HIV prevention and prophylaxis centers. We also visit the jail penitentiary units, and we meet there. We also meet with non-governmental organizations that are involved in HIV and AIDS programs. So I can tell you that the situation is changing. In some regions, it is improving, but regretfully, in some regions, it is not so. Last November, I visited the region of Arkhangelsk. And the year before that, members of our council have also visited Arkhangelsk Clinical Center on HIV prophylaxis. And we paid attention that this center is equipped with beautiful automated workplaces. It is connected to all the services, but it really lacks space. So they sit in a very small area. And the next year, when we came up there, we learned how the regional authorities have settled this problem. They have combined this center with the Arkhangelsk Clinical Skin Disease Center. And this decision was made without any consultations with medical specialists, with NGOs, or with patients. And we believe that such type of optimization is inadequate. I would call it this way. At the same time, we're also focusing on NGOs and their activities. Those NGOs who are aimed at HIV response measures, they are socially oriented NGOs by their definition, and they can count on financial support from the federal, regional, and local centers. And at the same time, they can get into the registry of non-governmental organizations that provide socially beneficial services. So we do have this list of socially beneficial NGOs, and right now it has 109 NGOs in this list. But a question to you. How do you think out of these 109 NGOs, how many of them are HIV/AIDS targeted NGOs? None. Zero. Why? Why is it so? Who is the person to blame for it? Who is to blame for it? No, that's not the guilt of the federal authorities. This is due to the fact that the NGOs that are working on the HIV problems do not think about this great chance, this opportunity that they can get into this list. Therefore, I definitely call to action those NGOs. This would be a real good area for you where you can get significant support resources, get into this list. This is a highly promising thing for all NGOs that are dealing with HIV response measures. Our council is here and it is ready to support these NGOs. And I would like to wish you success and good luck in this conference. Thank you. Thank you very much, Mikhail Alexandrovich. I would like to hand over now to Deputy Minister and Head Chief Sanitary Doctor of the Republic of Belarus. Dear Mrs. Chairman, dear ladies and gentlemen, on behalf of Vice Prime Minister of Belarus, Vasily Zharko, and Healthcare Minister, Mr. Malashko, I would like to welcome the 6th International Conference on AIDS in Central Asia and Eastern Europe. Thank you very much for inviting me to speak at this forum. Human health is one of the key welfares which defines the social and economic development of the nation. HIV issue and tackling this issue is one of the top priorities in Belarus. We follow 3 principles: coordinating activities in prophylaxis of HIV. We have a unified national framework, strategy, and intersectoral coordinating body, and unified monitoring system which assesses the HIV situation. In order to fulfill our commitments to United Nations, we are implementing the state national program, which is called the Healthcare of Belarus People, and which spans through 2020. The activity of this national program includes healthcare agencies such as the Ministry of Education is there too, the Ministry of Foreign Affairs, the Ministry of the Interior, and agencies and authorities which are playing a significant role in terms of preventing HIV proliferation. This state program has a budget that can subsidize non-governmental organization, and we do have a certain legal and regulatory framework to do so. But we cannot do that where we have stigmas and discrimination to HIV-positive people or to key populations. Therefore, Republic of Belarus is one of the countries in which we have implemented and are implementing information and raising awareness strategy. Using this program, we managed to change mass media position to key population groups and HIV-positive people. We're changing our society treatment of these people. We have Republican and monitoring groups which assess the situation. A number of social surveys are also being run in order to assess and monitor, track the situation on beach. We compile epidemiological data. All this allows us to detect some hidden factors that drive HIV propagation and also prepare the evidence base that can help us further improve our programs. Our country incrementally implements the program on how to reduce the consequences of HIV. We are part of a 1990 goal, and when we will be having the session, the panel sessions, I will have more time to tell in detail about our results and what we managed to achieve. But I can tell you now that our country, Belarus, thanks to joint coordinate efforts on behalf of international organizations and national organizations like WHO, UNAIDS, and NGOs, all these combined efforts made us achieve the success where we are today. I'm really glad that this conference will give us a chance to exchange our experience and will serve as another step towards reaching 1990 goal. Thank you very much again for inviting me, and good luck to all of you. Thank you, Natalia. And I would like now to give the floor to Albert Zagipov, who is chairman of the regional non-governmental organization, which is called Prophylaxis and Initiatives in terms of health care of society. So you have the floor now. Good morning, dear ladies and gentlemen. And in the very beginning, I would like to say big thanks to those who are engaged in HIV. So I'm HIV positive, and I received my status in early 2000. But there are problems. A lot of achievements have been made since then. Funding. Thank you so much for donors who support us. So how dependent we are on the foundation money. When the country will understand that this is the very important and priority issues, when will we stop knocking into the doors of highly ranking officials in terms of proving that this is important? Adolescents. The kids who were born with HIV, they are growing, and we still do not have a program which supports HIV-positive adolescents and young children. Number of people with HIV is growing, but number of HIV specialists is not growing. Migrants. We have a law in Russia which discriminates migrants who are HIV positive. So we should not close our eyes on that. There are more and more migrants who are HIV positive and who need support, who need help. But this is a fact, and we're closing eyes. We're not seeing it. What it leads to? It leads to even higher consolidation of the problem, even worse situation with that. And migrants, without any access to the treatment, they're all prone to die. Thank you, Albert. Елена Alexandrovna Rostokina. Елena is coordinator of the project at Kazakhstan for people who live with HIV. Dear participants in the conference, so yes, we're speaking about problems, but let's dream a little bit. Let's dream about the near future when Russia will support all programs so that people the drug users will not have access only to clean ejection instruments, but will also have access to methadone therapy. So we want to dream, and in the future that there is no longer place to disputes, that there is great access to international experience, which is evidence-based, and replacement therapy. And I would really hope that the countries in our region will, in the end of the day, will do everything for social rehabilitation for drug users, so that the drug users do have access to jobs, even if they have the disease. Kazakhstan, imagine, Kazakhstan will no longer be interested in protecting some pharmaceutical companies and buying medications which cost 3 times higher versus others. Only new types, advanced medications, combined therapy. So this is where we want to be. Medications should be coming in time. Commitment should be 100%. Professional medical experts. This is the dream. You would say, wow, this is something impossible, but this is impossible. Michel Sidibe visited personal Kazakhstan, and after his visit, the prices went down significantly, and I really want to say personally, big thank you to you for that, because your visit paid significant contribution to the situation in our country. So all these issues require significant changes in terms of laws, in terms of approaches among many countries and nations. I understand that this is a really challenging thing. United Nations effort cannot go alone with that. We need combined efforts. We need local support. I know that is really hard, and sometimes you have no more way to go with that, but only together, only pushing and pushing with that, we can get to the result. Thank you.
Thank you very much, Yelena. And the floor is given to the Director General of the Nuts and Beer company, Yuri Zgorsky. This is the floor is given to business. Esteemed Anna Yurovna, esteemed colleagues, Nuts and Beer, it's not the first time for Nuts and Beers to participate in a conference like that, because only through our combined efforts we can end the spread of this terrible disease with long-term social consequences. And it's very important that we gather here not only the people from the international communities, but also the HIV-infected people. We participate in this effort and have been participating for a long time. We support the HIV-infected children, and we participate in volunteer programs. The very important initiative is the Business Summit in the framework of this conference. This is the first time ever. It is very important to provide the state-of-the-art RT to the HIV-infected people, and it is only a possible with the cooperation of the government and pharma and health communities. Sergei mentioned that last year showed the efficiency of the coordination of efforts of the government and the pharma and the healthcare ministry and the anti-monopoly service. They monitor the prices of the drugs on a continuous basis, and with the effort of the Ministry of Trade, we managed to reduce the drugs price, and that allowed us to buy larger volumes without increasing the budget. We all know about the comorbidities, TB and hepatitis B and C. We are one of the largest producers of TB drugs, and also within the framework of the national calendar of prophylactic vaccination. We also provide the vaccines which are produced, the full cycle of which is produced in Russia. I want to join Yelena, and I want to dream somewhat. We are monitoring the R&D situation in the world market, and we think that within the next 5, 7, 10 years, the world and in our country will have vaccines against HIV, because we have grounds for this opinion. Thank you very much for allowing me to participate, and I wish you a productive 3 days. Thank you very much, Yuri. And Vikram Apuni, who is the head of the Farm Synthes joint stock company.
Добрый день.
Good afternoon, esteemed Presidium, esteemed colleagues. I'm the representative of business and pharma. I would like to inform you about what is happening in this industry as far as production and availability and accessibility of drugs is concerned. In the last 7 or 8 years in the Russian pharma, we've made a great step forward. If in 2010 the country imported over 90% of antiretrovirus drugs, right now we are producing over 70% of these drugs in the territory of the Russian Federation. Back in 2010, we only produced 2 names of RVT. Now we are producing over 7 of them. And now we started exporting these drugs, and this export goes to over 10 countries in the world. And we're very happy because we have the first innovative RVP, which are made in Russia. It happened because of the initiative of business itself, and also with the support of the Ministry of Trade and Industry of the Russian Federation, the government of the Russian Federation on the whole. Thank you very much. Dear colleagues, the key task for us is to manufacture drugs which will be accessible, and I would like to address the international patent pool. First of all, we want your success in localization or receiving licenses for patented drugs for the Russian Federation. And I know that you work in very many countries in the world. Russia is not an exclusion. Besides, I would like to appeal to the producers of the innovative ARVPs to localize their production in Russia, which will make it possible for the HIV patients and AIDS patients in Russia to have access to these drugs. Of course, all together we can fight this disease effectively. And at the end, I would like to thank the organizers of the conference, the guests of the conference who came from dozens of countries from all over the world, and I wish you successful work during the conference. Thank you very much. Thank you, Mr. Pudia, and esteemed colleagues. All the greetings that were supposed to be voiced have already been voiced, and I want to summarize our introduction session. We heard words from the representatives of international organizations, the governments in the regions, NGOs, various confessions, business representatives, organizing committee representatives. I want to say that all that we've heard today is definitely reflected in our huge 3-day program of the conference. No issue has been overlooked in this program, and for the first time ever, our program doesn't have 3 but 4 directions and 4 program commission. Traditionally, science and medicines, civil society, support for international development, and for the first time ever, we have another committee which is efficient prophylactics, because this is very important for us. This direction needs to be discussed seriously. This activity, we need your feedback, we need your efforts here, because this is going to be essential in trying to end the epidemic. We have 456 speakers during the 3 days. Your portfolios have the collection of resumes on various subjects. We used to have only 230 in 2014, and it shows, this increase shows that the interest of the international community of scientists is also growing. Also, you have the draft of the final document of the conference. Please carefully study the final draft, and probably you'll have some proposals for the organizing committee or the heads of the delegations. We have delegations participating in this conference, and also we have the editorial committee headed by Yuri Smolensky. All your proposals will be reviewed. You can submit them as of today, and the colleagues are will start working on the draft of the final document today, so that they would have the most important input, embracing all the areas of our work by the end of the last day of the conference. So right now we are going to have a break. You can visit the exhibition, which is very interesting, because we spent all night to build this exhibition. It was ready to open very early this morning, and at 12 we expect you all back for our first plenary session. Thank you very much.